Are we heading for another pandemic? The monkeypox virus turns up in yet more countries. The World Health Organization says it can still be contained, but should we be worried? I'm Jafar Hasnan, and this is the Newsmakers. The world still has not fully recovered from COVID-19, and now there is talk of another virus. Monkeypox is not new, but the way it has started to spread is causing concern. The disease is usually endemic to West and Central Africa, but now it has emerged in Europe, Australia, and America. Here's a breakdown of exactly where it is and how many confirmed cases there have been so far.
The UK was the first outside Western and Central Africa to detect the virus. It now has 71 confirmed cases. Spain has 48. Portugal has identified 39 cases of the virus. The Netherlands has 6, while France, Germany and Italy have all reported 5 cases so far. Belgium, Denmark, Switzerland, the Czech Republic, Slovenia, Sweden and Austria are the other European nations to be hit with infections. In North America, the Canadian Public Health Agency has reported 15 cases and the US has announced 2. 15,000 kilometers away in Australia, 2 people have been infected, and the United Arab Emirates and Israel are the first Middle Eastern countries to be infected.
So now we know where it has spread so far. Let's explore what monkeypox actually is.
The monkeypox virus is transmitted through close contact with animals, usually small mammals and rodents, but rarely between humans. When infected, this is what normally happens.
It usually starts with fever and headache. People feel pretty miserable and tired. They can get swollen glands, and then this typical rash develops, which is sort of pustular in form, and that's usually what's infectious, and this is infectious until the scabs actually fall off.
Most of the time the infection is mild and people recover within 2 to 4 weeks, but in rare cases it can be fatal. The virus was first discovered in lab monkeys in 1958, and the first known human infection was not recorded until 1970 in the Democratic Republic of Congo. Since then, outbreaks were normally contained to West and Central Africa. The virus belongs to the same family as smallpox, but it's much less lethal. The vaccine that helped eradicate that disease in the 1980s is thought to be 85% effective against monkeypox.
For the first time, the virus is being detected in people with no clear connection to Western and Central Africa. The rate at which the infection is spreading has surprised scientists. Belgium became the first country to introduce a mandatory 21-day quarantine for those infected. Germany has ordered 40,000 vaccines as a precaution, and US President Joe Biden says the outbreak is something he is worried about.
Well, they haven't told me the level of exposure yet, but it is something that everybody should be concerned about. We're working on it hard. Figure out what we do and what vaccine, if any, may be available for it. But it is a concern in the sense that if it were to spread, it's consequential. That's all they've told me.
So what does the World Health Organization think about the monkeypox outbreak? Well, joining me now to discuss it is Tarik Jasarevic. He is the spokesperson of the World Health Organization. Tarik, thank you very much for joining us here on the Newsmakers. Now, after living more than 2 years through a global pandemic, I think it's natural for people and authorities to be alarmed by the news of another virus outbreak. People are worried. There is confusion among the masses. So to start off, just help us understand, how concerned should we be?
Well, I think we should look into this more closely because the situation is very atypical. Normally, monkeypox virus is endemic in certain countries in Africa. And in recent years, when we have been seeing cases outside those endemic countries, all those cases have been linked to travel. Now, this time around, we have 189 confirmed cases so far in 23 countries, with majority of cases not having this travel history. We know that monkeypox is transmitted human to human, but let's put things in perspective. The risk for general population appears to be low. Monkeypox is being transmitted from one person to another through close skin contact. And if we manage to identify people who have smallpox, and if we manage to avoid having close contact with other people, we will be able to break the chains of transmission. It's really important to say also that so far no one has died, and the majority of people who get the disease will have mild symptoms, and then disease will go away.
Now, Tarik, over the past few days, many countries have reported new cases of monkeypox. In fact, some countries have reported a significant increase in the total number of confirmed cases. For example, the UK reported 14 new cases on Tuesday. So tell me, how likely is it for this monkeypox outbreak to get out of control?
Well, as we ask countries to increase and strengthen surveillance, we are likely to see more cases. This is normal. Now, what is important is that we try to identify those cases to make sure that people who are diagnosed with monkeypox are isolated and they do not transmit disease further. At this stage, we really think that this is containable and that people should be aware of this. But we just have to work together with member states and countries and health authorities, so anyone who is a confirmed case is being isolated. And it's also really important to stress at this point that anyone can get monkeypox, that it's not a disease of a particular group of people, so everyone should be really on a lookout for any possible outbreak in their area. And if person thinks that he or she has been in contact with someone and it's starting getting symptoms such as fever, rash, skin lesions, this person should contact health authorities.
All right, Tarik Jasarevic, thank you very much for talking to us here on The Newsmakers. Let's broaden out the discussion now and bring in three new guests. From London is Global Health Advisor Oksana Pyzik. She's also a Senior Teaching Fellow at the University College London's School of Pharmacy. Stephen van Gucht is in Brussels. He's the head of viral diseases at Sciensano, Belgium's National Institute for Public and Animal Health. And also from Brussels is Benjamin Neuman, a professor of biology and chief virologist of the Global Health Research Complex at Texas A&M University. Thanks all for being with us today here on The Newsmakers. Now, most of the times, fear arises from uncertainty revolving around a certain virus or disease. For example, in the case of COVID, people were scared because not much was known about SARS-CoV-2, especially in the initial phase of the pandemic. In fact, even right now, scientists do not know everything about this particular coronavirus. But monkeypox is not a new disease. It has been with us for several decades. So, Benjamin, we should, in reality, have enough information about this virus to contain it easily, right?
If only. Now, any new virus outbreak comes with surprises because there are going to be genetic differences, and even a small difference can change the way one virus protein interacts with one part of the cell. There are big machines at work, the viral machines and the cellular machines, and it's the interaction between the two that kind of determines whether or not there will be disease. So we know enough to control it in that if you stay away from people with no direct contact and no face-to-face contact, it'll be all right. But we certainly don't know everything about this new strain, although it is a very similar genome to one that was isolated in Nigeria and spread to the UK in 2018.
Okay. Oksana, let me come to you. How do we contain monkeypox outbreak? What's the best way to do so?
Again, you need close physical contact for there to be transmission. So in that sense, it's definitely not as contagious as COVID, for example. So isolation, though, is still the best preventative measure. It is like any virus, it needs a vector and it needs to be transmitted amongst the population. So when people have symptoms, they need to come forward. And people have been noticing these lesions, they've gotten the treatment, and then they have to isolate. Most cases have been mild. Outside of where the endemic regions, and mostly Central and West Africa, there have been no hospitalizations and no deaths reported so far. So the best measure is to be aware, if there are any symptoms, to ensure that people have them investigated, and then for isolation to occur. The problem could be if people are ignoring symptoms and ignoring isolation requirements.
Okay, so this essentially means that we need to introduce new measures. Stephen, let me come to you. To what extent do you think we need to apply the same measures that we used to contain COVID-19 in order to mitigate this outbreak of monkeypox?
Well, some measures can be very useful. First of all, we need to find the cases. So good communication and awareness, targeted communication also, because for the moment we see most cases are in the community of men who have sex with men. So we should target our communication towards that community particularly, without creating stigma. So once you find the cases, they should isolate. And that's very similar to what we have done with COVID cases. If you were infected with the virus, coronavirus, or in this case, the pox virus, you should isolate and refrain as much as possible from contact with other people. That's quite similar. Another thing that is also similar is the contact tracing process. Then you want to look for all the high-risk contacts, people that were into contact during the infectious period and that might also develop the disease 1, 2, or 3 weeks later. And these people should also remain very careful throughout this period. In Belgium, we ask them to self-monitor, so they're not really supposed to go in complete quarantine. That's a bit different from with COVID. We tell them that they should be very watchful for the appearance of symptoms that might start with flu. Then you can get a rash and you can get vesicles. As soon as you notice symptoms, you should isolate and get a test. We made a little exception for the very high-risk contacts. These are people that had sexual intercourse with a person during the infectious period. We tell them that it's best that they wear a mask in the 3 weeks following the exposure. And if they come into contact normally because of their job, for example, with young children, or people that are immune suppressed or pregnant women, then we tell them to better stay at home, because these are the kind of contacts we absolutely want to avoid, because young children, immune compromised people, or pregnant women, they might be at higher risk of disease if they catch monkeypox. So this is contact tracing, isolation, quarantine is quite similar, but I don't think we need general measures like we did for COVID, for example, reducing the number of contacts in the general population. That's not necessary.
Okay, you know, it's surreal. We still haven't fully recovered from the coronavirus pandemic, and there's a new virus outbreak. Benjamin, so, I mean, it's natural, like I said, in the introduction to the program, for people to have concerns and be scared. And there's this question which is on a lot of people's mind right now. How likely is it for monkeypox to result in a pandemic?
This is the big question. So the word on monkeypox, at least in the virology community, has been that this thing has all the same equipment as you would find in the smallpox virus. But unlike smallpox, monkeypox has never really figured out human-to-human spread with any sort of efficiency. That's why you're seeing the recommendation against close skin-to-skin contact. That's sort of the highest possible bar, basically. So we have a virus that could be bad, but at the moment doesn't appear to be. And scientists will be watching. So we're watching this one to see whether or not something has changed. From the look of it right now, this appears to be a virus that normally spreads by close contact, that just happened to be in a position where there was a lot of close contact. basically a virus that got lucky. Now, as we continue to monitor the situation, this may change. There may be some update, but for now, it just looks like a virus that happened to get out of hand, more a coincidence.
Benjamin, if I may interject here. Now, monkeypox was prevalent mostly in African countries, some of which were declared endemic countries. But now we are seeing outbreaks in non-endemic countries. Why is that? Has the virus become smarter? Why are we seeing this right now?
Yes, we saw essentially a person from an endemic country travel, meet up with a large number of people from non-endemic countries, and we had sort of one level of spread beyond that. The question will be, can the virus spread beyond this? Now, the WHO have not updated their numbers since previous Saturday, when they were looking at 92 confirmed cases and another 28 possibles. And a scan through the news suggests that there are not many of those possibles that have turned out to be confirmed cases. So we may be at a single round of spread, which is effectively self-limiting with the quarantine measures that the other two doctors mentioned.
Okay. Oksana, now monkeypox comes from the same family of virus as the smallpox. Correct me if I'm wrong, the orthopox viruses. We were able to eradicate a smallpox. Why haven't we eradicated monkeypox yet? It has been with us for several decades now.
Largely, like many other neglected tropical diseases, it has a lot to do with the resources available and where it is in the world. We have to be frank about the fact that it's getting international attention now because it is outside of Western and Central Africa. And it hasn't had such a global spread. I think there's also perhaps a bit of more caution around tracking outbreaks because of COVID, and certainly officials do not want to be missing anything. So the WHO, I think, have updated their numbers to 189 confirmed cases. But the good news about this orthopox virus, first of all, monkeypox is much more mild than smallpox, still has a high estimated mortality rate, 3 to 6% in cases reported, but that's not necessarily very accurate, again, because of the flawed surveillance previously. So it's at best a rough estimate. We certainly can't say that with a high degree.
But Oksana, if I may interject, the fatality rate varies between two different variants, right? One is more lethal than the other, correct?
Yes, that is also true. But overall, orthopox viruses are more stable and tend to mutate less than coronaviruses, for instance. So although we don't have, this is an evolving situation, and scientists are tracking and monitoring very closely, that is some encouraging news in terms of looking at just the probability of it being again, mutations, etc.
Okay. Now, Stephen, undoubtedly, vaccines played a crucial role in the eradication of smallpox. Well, we have some good news. The vaccine which worked against smallpox also works against monkeypox. But just help us understand, to what extent do you think we have the ability, the capacity to produce vaccines so that this new outbreak can also be eradicated?
Well, it depends on what type of vaccine we're looking at. We have the old generation of vaccines, and very often countries have stockpiles of these vaccines. Usually it's part of the defense program, because there always has been a worry that the old smallpox virus would be used as a bioterrorist weapon or as a military weapon. And so a lot of countries stockpiled smallpox vaccines in case it would ever be needed. Now, these vaccines, they have quite some side effects. So I would be quite wary to use them for monkeypox, because until now, most cases of monkeypox seem to be relatively mild. And you have to, of course, look at the benefit risk. The old generation vaccine can have some severe side effects. There is a newer generation of monkeypox vaccine, which is a lot safer. And that one was developed by a German company called Bavarian Nordic. I think it's quite a safe and probably also effective vaccine, but supply is limited. And that will require some time if you ever want to use that, especially on a larger scale. I think for small scale use, very targeted, for example, high risk exposure contacts, you might say, okay, let's vaccinate them, because you can vaccinate people in the first days after they have been exposed, ideally in the first 4 days. And that might prevent them from becoming sick and maybe even from becoming infectious. So that might be an application for this new generation of vaccines. If you want to apply it really on a broader scale, then that might take some more time because the supply will be limited. I don't think it's really, at this moment, I'm not convinced that it's really necessary to have vaccines to control this problem. Probably you can also do it with good contact tracing, isolation and quarantining, and raising awareness, because for the moment I think it's...
But Stephen, if I may, but that's not a permanent solution to monkeypox, right? What would be a permanent solution?
Permanent solution would to find out what is driving the outbreaks in Africa, because the virus is really circulating mostly in Western and Central Africa. It's jumping from animals to humans, and this happens on a regular basis. So we really need to understand the dynamics in Africa and make sure you no longer have these spillovers from animals to humans. If you don't get these regular outbreaks in Congo or Nigeria, the risk of the virus spreading to other parts of the world will also reduce, I think. So we need to understand dynamics in Africa and then try to control it better over there. I think that's what needs to happen in the future.
Okay. Now, we addressed the vaccine front, so there are vaccines available. Of course, the older version of the vaccine has some concerns revolving around it, but the newer version that, Stephen, you just mentioned, has higher efficacy and it's relatively safer. Benjamin, let me come to you now. I also want to discuss whether or not we have treatment drugs against monkeypox. Do we?
For the most part, it is difficult to treat pox viruses. There is a candidate treatment that would inhibit entry, but no, by far the best solution to this, I think, is vaccination. And we're looking at this one problem, these cases that got out of West Africa. But at the same time, you had, over the last year, over 1,000 cases of the more severe strain of monkeypox in the Congo. So this is a relatively large problem, and one that is set to grow potentially as basically we have stopped vaccinating against smallpox. I think, though, the other doctor's point is very good. We don't actually know where this virus comes from. It tends to be associated with grasslands, kind of at the edge of the jungles. There are a lot of different animals in there that have been reported once or twice to have a virus like this. But until we're sure where it's coming from, it's very difficult to stop it getting out.
But Benjamin, why is it taking so long? I mean, with all due respect, because scientists have done a tremendous job in helping humanity throughout decades, centuries. But why is it taking so long to find out the source?
It's a matter of money. There are so many viruses in the world, far more viruses than virologists. And different countries support research in areas where they think there's going to be a problem. And it's really hard to judge which one can pop up next.
Okay. Oksana, over the past few decades, in fact, over the past 1 decade, we have seen many outbreaks of viruses emerging. There was Ebola outbreak, Zika virus outbreak, coronavirus outbreak, and now we have this monkeypox outbreak. Is this odd? Is this a high number of outbreaks for one single decade, or perhaps something normal?
I think we're probably in the future going to see more and more due to things like climate change, warmer climates. With Zika in Brazil, that was a first in that area to see Zika, which even had cases in the United States as well. And that was certainly a first where there was a travel warning for people within the United States pre-COVID. So I think we have to get used to the fact that with these dynamics, climate change being a big part of seeing, as well as deforestation and agricultural practices, I think the one that we're going to have to be really worried about is avian flu in the future, particularly because we have we are overdue for it in the first instance. There has been concerns about a big flu pandemic. We ended up with the coronavirus pandemic instead, but that doesn't rule out other viruses. Again, the UK had their emergency plans all modeled for the flu pandemic, and that has different dynamics, although in some ways similar. So again, I think we have to look at this holistically and a One Health approach, where we look at our practices with agriculture, where we're encouraging this encroachment and mixing between humans and livestock, and really creating conditions that favor this zoonotic spillover. So again, not only is it just part of the natural environment, we're pushing that to the bounds. This could be the payback.
All right, it's such an important topic, but unfortunately, we're out of time. Oksana, Stephen, Benjamin, thank you very much for talking to us today here on The Newsmakers. And thank you for watching. Be sure to subscribe to our YouTube channel. I'm Jafar Hasnan. See you next time.